Ray has been assigned on yet another business trip to China, Shanghai, to negotiate a multi-million-dollar deal with one of his firm's clients. Hearing that there is a possible MERS case in Shanghai, Ray's concerned boss told him about the disease tracker mobile application. Being cautious about his safety, Ray downloaded the application immediately after returning back to his desk. Upon launching the application, Ray was asked to provide his contact information and was also presented with the terms and conditions of the application. Feeling assured with the usage of information collected, and as a first-time user, he provides his contact number and agrees to the terms and conditions. Ray's local contact number is 9123-4567. Without further delay, he assesses the current disease outbreak status in China. To his relief, there is only one confirmed case in China, and the overall risk of traveling to China is low. He also reads up on the official health advisory given by MOH. The symptoms of MERS, and also the precautionary measures he should take to protect himself. Armed with this proper information, Ray feels at ease on traveling to China. Ray boards his flight the following day and arrives in Shanghai. Upon arrival, he immediately switches on his phone and turns on auto roaming. He is concerned to receive a risk alert notification via the disease tracker mobile application, informing him that there have been more confirmed outbreaks in China. He heads to a convenience shop at the airport to buy a mask for himself and makes his way over to the hotel whilst wearing the mask and retires for the night. In the morning, Ray attends his business meeting, and as part of business etiquette, he turns up without wearing his mask. His clients were impressed by the business proposal and decide to sign a multi-million-dollar contract with Ray's company. Pleased with his performance, he boards the flight back to Singapore the following day. Unknown to Ray, his business clients were infected with MERS and he is inadvertently exposed. The Chinese authorities conduct contact tracing using the disease tracker mobile web application, and update the information which is stored in the World Health Organization database. Dr. Timothy in his office suddenly receives an alert from the disease tracker web application. Investigating further, he finds that there are 5 Singaporeans who have been in contact with an infected person at China World Tower. As part of his responsibility, he immediately sends a suspected case notification with a message informing them that they may have been in close contact with the MERS carrier on the 29th of September 2015 at China World Tower. The Singaporean suspects include Ray, who may have been potentially exposed to MERS because of the time and proximity spent together with the victim. The suspected case notification alert is sent to Ray's mobile phone, which he provided when he downloaded the application, advising him to take precautionary measures which include seeking immediate medical attention and to avoid others if possible. Upon arrival in Singapore, Ray is immediately notified that he may have been potentially exposed to MERS via the mobile application. He immediately reads up on the possible symptoms of MERS, which include cough, shortness of breath, and fever. He heeds the precautionary measures given by Dr. Timothy, specifically to avoid others if possible, by imposing self-quarantine in his home. Unfortunately, 3 days later, Ray is dismayed to find that he exhibits symptoms of MERS. Once again, he follows the precautionary advice given in the suspected case notification and immediately calls for the emergency medical services and informs them that he is a potential MERS carrier. Ray is then securely transported to the hospital, and after close observation and tests, he is confirmed to be contracted with MERS. Fortunately, he recovers in due time owing to the quick identification of the disease tracker mobile application. His self-quarantine led to his family being safe from MERS, and his self-identification to the emergency medical services also allowed the Singapore health system to take preventative measures early and isolate him in a single patient ward. This prevented further infection amongst his fellow patients and medical professionals alike.